Hi, my name is Chinasa. I'm a sister, I'm a daughter, but I'm also a scholar and a relentless advocate for the million whose stories are too often left untold.
Every community is completely distinct, but the threads that make it distinct are very common throughout the world. So if you examine those threads, you begin to compare places that people wouldn't think of comparing, and you get clarity that people don't normally get in these conversations.
If you look at Nigeria's national health accounts, at least the last one was done in 2016, published in 2018, the estimated total health expenditure was $10 billion. $2.3 billion of that amount Nigerians spent in chemists and pharmacies.
Basically, safety net means kind of hospitals, clinics, or other entities that provide care that's usually focused on disadvantaged communities and has some kind of subsidized or sliding scale services so that it's more inclusive. So they could be hospitals that provide more uncompensated care. So it's places that have, in theory, less of a profit motive.
I don't know if you know this, but internet connection is now considered a social determinant of health. Those that have, internet connection have, more likelihood to have better health outcomes than those who do not have.
Everybody is a health ambassador. It is not only the matters of those who have been trained, who have trained themselves as a medical professional or health professionals. No, when you receive a good information and you share with the person the right information, and then you become a health ambassador.
This was the situation wherein we were supposed to deliver 7 million bed nets across 16 districts, as you mentioned. And I just want to talk about a system that they actually rolled out. This is a system that I would recommend for any organization that is engaged in distribution of health commodities to beneficiaries. They call it the Red Rose system.
There is no way you're going to better the working environment of a health worker without first ensuring that the patient can be able to receive better care. Because a better environment for a healthcare worker means that they have the requisite tools and equipment and the essential supplies that they need to ensure that their patient is treated well.
Most of the diseases that I see are preventable diseases.
Yes.
Specifically infectious diseases, specifically diseases that you see in poor people. So those are the type of patients that I consult.
Like, intimate partner violence is a public health issue, I always remind people. And preventing it is different from when we're trying to prevent like a pandemic, or we're trying to prevent, a health issue that just came.
When communities are able to band together to ask for shared resources that they'll all benefit from, then you have solidarity around the identified sort of political ask. You've got advocacy that's bringing people together, and they're all collectively thinking about how they can be uplifted as a group.